Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. Today we'll delve into the world of gout, a condition that affects millions of people worldwide. Whether you're here to understand its causes, symptoms, or how to manage it, you've come to the right place. We'll break down complex medical information into easy-to-understand language so that you can make informed decisions about your health or support someone you care about dealing with gout. So, let's jump right in and explore everything you need to know about gout. What is gout? Gout manifests as painful bouts of inflammation affecting one or multiple joints. This ailment falls within the spectrum of arthritis, though it markedly differs from the more prevalent forms such as rheumatoid arthritis and osteoarthritis. The agony experienced during a gout attack can be notably intense. Causes of gout. Gout stems from the presence of a chemical compound called uric acid, urate, in the bloodstream. Ordinarily, uric acid is harmless and produced within the body. Most of it is naturally excreted through urine, with a small portion eliminated through feces. However, individuals with gout exhibit an accumulation of uric acid levels in their blood. Periodically, these elevated levels can lead to the formation of minute crystal-like deposits of uric acid. These urate crystals tend to accumulate within joints, subsequently provoking irritation and inflammation of the joint tissues, resulting in pain, a classic symptom of gout attacks. It is noteworthy that some individuals may have elevated uric acid levels without forming uric acid crystals or developing gout, while exceptionally, individuals with normal uric acid levels can experience gout attacks. Nonetheless, as a general principle, the higher the uric acid level, the greater the likelihood of gout development. Effective management of gout often entails lifestyle modifications, including weight loss for those who are overweight, adopting a balanced diet, and limiting the consumption of alcohol and sugar-sweetened beverages. In cases where gout attacks persist, the daily use of specific medications like Allopurinol can serve as a preventive measure to mitigate their recurrence. We will discuss this in more detail later on in the video. Why does uric acid build up? Uric acid builds up in the body when there's an imbalance between how much is produced and how much is eliminated. Normally, the body maintains a healthy level of uric acid in the blood by excreting it through the urine and stools. However, in many people with gout, this balance is disrupted, leading to elevated uric acid levels. Here are some reasons why uric acid might accumulate. Underexcretion of uric acid. In most cases of gout, the kidneys don't eliminate enough uric acid, causing it to accumulate in the blood. This condition is known as being an underexcretor of uric acid. Interestingly, despite this, the kidneys usually function normally for other purposes. Alcohol consumption. Consuming excessive amounts of alcohol can lead to the buildup of uric acid in the body. So, cutting back on alcohol can be beneficial for people prone to gout. Certain medications, some medications, like diuretics, commonly known as water tablets, aspirin, and certain chemotherapy drugs, can increase uric acid levels in the blood. Increased production of uric acid. In some illnesses where the body's cells have a high turnover rate, more uric acid than usual is produced. This can occur in conditions like severe psoriasis and certain blood disorders. Risk factors. Certain health conditions and factors can increase the risk of developing gout. These include obesity, high blood pressure, kidney damage, diabetes, bone marrow disorders, lipid disorders, especially hypertriglyceridemia, and vascular disease. How common is gout? Gout affects approximately 1 in 50 adults. It's more common in men than in women. While the first gout attack often strikes in middle age, it can sometimes occur in younger people, although it's rare in those under 20 years old. What are the symptoms of gout? Gout tends to come in sudden attacks that develop rapidly over a few hours. These attacks typically bring intense pain to a single joint, with the big toe being the most commonly affected. Walking can be excruciating, and even the weight of a blanket can be painful. However, gout can target any joint, sometimes affecting 2 or more joints. The affected joint usually swells, and the nearby skin might appear red and inflamed. Without treatment, a gout attack can last several days but usually resolves within 10 days. Occasionally, less severe attacks can occur, which may be mistaken for other types of arthritis. Some people experience only one gout attack in their lifetime. Is gout serious? While a gout attack can be incredibly painful, other complications are less common. Repeated attacks can lead to joint damage. In a small number of cases, uric acid crystals can form kidney stones or cause some kidney damage. Sometimes, these crystals accumulate in the joints, creating painless bumps called tophi. However, tophi can sometimes form in inconvenient places, such as the ends of fingers, and occasionally become infected. How is gout diagnosed? Doctors typically diagnose gout when a person has the classic symptoms of the condition along with elevated levels of uric acid, urate, in the blood. If there's uncertainty about the cause of joint pain and swelling, a doctor might use a needle and syringe to extract fluid from a swollen joint. This fluid is examined under a microscope to confirm the presence of uric acid crystals, thus confirming the diagnosis of gout. Treatment for gout. General measures. Elevate the affected limb, if possible, raise the affected limb, usually a leg, to reduce swelling. A simple way to do this is by reclining on a sofa with your leg propped up on a cushion. Use ice packs. Applying an ice pack or a bag of frozen peas wrapped in a towel can help alleviate pain until specific gout medications take effect. Apply it for around 20 minutes at a time, ensuring that the affected area returns to its normal temperature before reapplying. Anti-inflammatory painkillers. Quick relief. Most gout attacks can be swiftly eased with a short course of anti-inflammatory painkillers. These medications, including colchicine, diclofenac, indomethacin, and naproxen, can provide relief within 12 to 24 hours. Your doctor will prescribe the most suitable one for you. Caution with side effects. While many people can take these painkillers without issues, they can cause side effects in some individuals. The most serious potential side effect is stomach bleeding, which is more concerning in individuals over 65 or those with a history of stomach ulcers. Seek medical attention if you experience indigestion, upper abdominal pain, pass black stools, vomit, or see blood after taking these medications. Colchicine commonly causes diarrhea as a side effect. Check the leaflet provided with the tablets for a list of other possible side effects. Consider pre-existing conditions. People with conditions like asthma, high blood pressure, certain kidney problems, and heart failure may not be suitable candidates for anti-inflammatory painkillers. Also, if you're taking other medications, consult your doctor or pharmacist to ensure there are no harmful interactions. Be cautious with multiple painkillers. Avoid taking more than one anti-inflammatory painkiller at once unless advised by a doctor. For instance, if you're already on low-dose aspirin, which is considered an anti-inflammatory medicine, for blood clot prevention and develop gout, discuss your options with your doctor. They may recommend additional protection for your stomach, for example lansoprazole, if you need to take both aspirin and another anti-inflammatory medicine. Keep in mind that some over-the-counter painkillers may contain aspirin. Other gout treatment options. Steroids, steroid tablets or steroid injections are additional options for reducing pain and inflammation during gout attacks. They become a choice when anti-inflammatory painkillers and colchicine are not suitable or well tolerated. Canakinumab is a relatively recent addition to the options for gout treatment. Preventing gout. Lifestyle measures. Weight management. If you are overweight, losing some weight can help reduce uric acid levels, urate. However, avoid diets that increase uric acid levels, such as high-protein or starvation diets. Alcohol consumption. If you consume a lot of alcohol, consider reducing your intake. You don't necessarily have to quit drinking altogether, but cutting down, especially on binge drinking, can be beneficial. For reference, men and women should aim for no more than 14 units of alcohol per week, with no more than 3 units in a single day, and at least 2 alcohol-free days weekly. Sugar-sweetened soft drinks. If you regularly consume sugar-sweetened soft drinks, particularly those with fructose, consider reducing your intake or eliminating them altogether. Medication review. Check if any of the medications you are currently taking might contribute to gout, as mentioned earlier. Discuss alternatives with your doctor if necessary. Stay hydrated. Avoid dehydration by drinking an adequate amount of water, up to 2 liters per day unless medically advised otherwise. Blood pressure check. Have your blood pressure checked at least once a year, as high blood pressure is more common in individuals with gout. These lifestyle measures, combined with appropriate medications if needed, can help prevent gout attacks and manage the condition effectively. Always consult with your healthcare provider for personalized advice and treatment options. Allopurinol. Allopurinol is a commonly prescribed medication for preventing gout attacks. However, it's important to understand that allopurinol is not a painkiller, and it does not provide immediate relief during a gout attack. Instead, it works by reducing the level of uric acid in your blood. It takes a bit of time to become fully effective, typically around 2 to 3 months. To keep uric acid levels in check and prevent gout attacks, you need to take allopurinol daily. Your doctor may recommend allopurinol if you've had 2 or more gout attacks within a year. You have 1 or more tophi, those uric acid crystal deposits described earlier. Gout has caused damage to your joints or kidneys. You've had kidney stones made from uric acid. You're on long-term medication that can potentially trigger gout. It's worth noting that when you start taking allopurinol, it can sometimes lead to a gout attack. For this reason, it's usually not initiated during an ongoing gout attack. Instead, it's best to begin about 3 to 4 weeks after an attack has subsided. During the first 2 to 3 months of allopurinol treatment, your doctor may also prescribe an anti-inflammatory painkiller as a precaution against potential gout attacks. Once your uric acid levels are under control, taking allopurinol daily is typically effective in preventing gout attacks. The specific dose of allopurinol varies from person to person, usually starting with a low dose. A blood test is often conducted after a month to ensure that uric acid levels have decreased. If they haven't, your dose may need adjustment. Most individuals end up taking a daily dose ranging from 100 to 300 milligrams to prevent gout attacks. If a gout attack occurs while you're on allopurinol, you can still use an anti-inflammatory painkiller to alleviate the pain. However, this might indicate the need for an increased allopurinol dose. Fortunately, side effects with allopurinol are rare. If side effects do occur, your doctor might explore other medications with similar effects. For instance, a medication called febuxostat might be an option if you cannot take allopurinol due to medical reasons or side effects. Other medications for preventing gout attacks. In cases where allopurinol isn't suitable, other options are available, including febuxostat, effective in keeping uric acid levels low but may have side effects. Probenecid, benzbromarone, alternative medications for those with allopurinol issues. Low-dose steroids, colchicine, and anti-inflammatory medicines, additional choices to prevent gout attacks. Prognosis for gout. When it comes to gout, here's what you can anticipate. Acute gout attacks. A sudden onset gout attack typically gets better within 1 to 2 weeks with proper treatment and management. Risk of recurrence. Unfortunately, gout can be a recurrent condition. About 2 out of every 3 people who experience one acute gout attack will likely have another one within the following year. Chronic gout. Repeated acute gout attacks and long-lasting, chronic gout can result in ongoing joint damage. This, in turn, leads to persistent pain and possible disability in the affected joints. And that's it, guys. We have covered a lot of useful information today. I hope that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.